Okay guys, welcome to the second episode of Ophthalmology Tuition Classes by Dr. Manish Chhabra. So we have done some embryology of eye, including how the optic nerve is formed, how the lens is formed, how is retina is formed, and also the blood supply, the venous drainage and arterial supply of the eyeball. Okay, now first we need to understand, as I had told you, that there is sclera which is posterior 5/6 and there is cornea which is anterior 1/6, right? Now can you appreciate if we see grossly? If we grossly see, so you can appreciate that this is your upper eyelid, this part, and then we have got lower eyelid, yes, and eyeball is covered by the eyelid. This is upper eyelid, this is lower eyelid. Now the point where the upper and lower eyelid meet, one at the nasal side, another at the temporal side, so this is known as canthus. Now if it is on the nasal side, it is known as medial canthus. If it is on the temporal side, it is known as lateral canthus. And at the eyelid level, so there are eyelashes which you also call as cilia, yes. And if we talk about the eyeball, so you can see that the sclera part is visible and there is the central part which is cornea which is visible. Now there is a transparent sheet which is present over to the bulbar region of the eyeball, that is conjunctiva. This conjunctiva has got three parts: one which covers the bulbar part of the eyeball, the second which covers the innermost part of the eyelid, the upper and lower eyelid, that is known as palpebral conjunctiva, and the junction of bulbar and palpebral conjunctiva is your fornix. I again repeat, so conjunctiva has got three parts, you know na, we are doing basics. So one is which covers the eyeball, it is bulbar conjunctiva, bulb, so you call bulb the eyeball, bulbar conjunctiva. Then palpebral conjunctiva, palpebral is which is the innermost covering of the eyelid. Then the junction of bulbar and palpebral is your fornix. Okay, all right. Now taking it a little higher, so I told you that there is sclera and cornea. So you know that anterior 1/6 is cornea, anterior 1/6 is cornea. Now how many layers of the cornea are there? Please remember with me: A, B, C, D and E. A is anterior epithelium, B is Bowman's layer or Bowman's membrane, C is, of course it is stroma, but for the ease of learning you can call it as cornea stroma because we are talking of the layers of cornea. D is, there is Dua's layer, and then there is Descemet's layer, Descemet's, D-E S-C-E-M-E-T-S, Descemet's layer. E is endothelium, okay. So A, B, C, D, E, I am writing it here because here I'll find more space. Okay, now anterior epithelium is further having 6 to 7 layers. So there are epithelium cells which are present like this: one layer, second layer, third layer. So there are 6 to 7 layers. Stroma forms the bulk of cornea. Bulk means, so what is the average thickness of cornea? So average thickness of cornea is 500 to 600 overall, but if we calculate the thickness in majority of population, it comes down to nearly 540 micron. Now my next question to you is, how do we measure the thickness of cornea? The process is known as pachymetry. Out of this 540 micron, anterior epithelium is approximately 60 to 70 micron, while stroma is approximately 490 to 500 micron. That is why I told you that it forms bulk of the cornea. Then do you know that stroma helps in maintaining transparency? How? See, so there are lamellar arrangement of the stroma. Just understand, there is a lamellar arrangement of the stroma such that the space between lamellas is less than wavelength of light, so that the light rays which are getting diffracted, they will get cancelled with each other. So lamellar arrangement in which the space is less than wavelength of light, so that there is no interference. Also there is presence of one chemical which is keratin sulfate, which provides transparency to the cornea. Okay, all right. And if we further talk about transparency, so there is another layer which is endothelium of the cornea, which is the innermost layer of the cornea. So endothelium has got sodium potassium pumps. These sodium potassium pumps, they use ATP, so they are most metabolically active components of the layer of the cornea. Now the purpose of these pumps is to throw 3 sodium in the anterior chamber and take 2 potassium inside the cornea. Now the water follows the sodium ions, and hence the corneal stroma is maintained in dry state. So 3 sodium in the anterior chamber, 2 potassium in the stroma. Of course, water will follow this. Water will follow, and hence the stroma will remain dehydrated. Dehydrated stroma is better. If it becomes edematous, it will lose its transparency. So stroma is clear. Stroma remains clear. Okay. Now this is about transparency of the cornea. I am writing it here. Keratin sulfate is present where? It is present in stroma, and it is for transparency of cornea. Okay. Now after moving to from the stroma towards the inner layers, we find that there is Dua's layer. The other name of Dua's layer is, because it is lying anterior to Descemet's membrane, it is pre-Descemet's layer. Now earlier it was not discovered because it was believed that it is a part of the stroma only, but once it is discovered by Professor Harminder Dua, that is why the name Dua's layer. He is a practicing ophthalmologist in UK. Okay, and this layer is regarded as strongest layer of the cornea. So that is your Dua's layer. Next is your Descemet's layer or Descemet's membrane. Earlier it was regarded as strongest layer. Okay, Descemet's membrane. And finally we have got endothelium. Now endothelium consists of single layer. It is a single layer, and there are presence of endothelium cells whose density in adults, if I talk about adults, the density is 2700 to 3000 cells per millimeter square. But if we talk about its density in children or in newborns, in newborns, शिशु, नए जन्मे शिशु, newborns, it is 5000 to 7000 cells per millimeter square. Now another important point, the rate of decrease in endothelium is 0.8 to 1% per year. This is a physiological decrease. Please write with me, rate of decrease in ECC. I'll tell you what is ECC. It is 0.8 to 1% per year. This is the normal. Now ECC is your endothelium cell count. It is endothelium cell count. Okay, now these endothelium cells, as I told you, they are important in maintaining transparency of the cornea because they have got sodium potassium pumps. Now these endothelium cells have a critical density. So critical density is that density under which they will not be able to throw effectively 3 sodiums in the anterior chamber and take 2 potassium inside the cornea. Hence the water will not flow out. Hence there will be edema of the cornea. So critical density is that value when the endothelium cell density reduces. Under that, the cornea will become edematous. There will be fluid in the cornea. Please write with me. So critical cell count or critical density, how much it is? 500 cells per millimeter square. So critical cell count is that count under which, please write with me, I am writing with you, yes, under which there is corneal edema. Corneal edema due to insufficient function of sodium potassium pumps. Okay, now please make a short cute box since we are talking of endothelium cell density. Now what is the minimum endothelium cell count which is required if you want to transplant the cornea? It is 1500 cells per millimeter square. It is minimum endothelial cell count which is required for keratoplasty. What is keratoplasty? It is corneal transplantation. I am writing it here for you guys. It is cornea transplant. That is the minimum endothelial cell count which is required. So this is about the layers of the cornea. Now gross, what is the diameter of the cornea? So first and foremost is your cornea is a watch glass like structure. Watch glass like structure. Now normal diameter is 10 to 11 millimeter. If it is less than 9 millimeter, you call it as microcornea. If it is more than 12 millimeter, you call it as megalocornea. These are all the basic terms which all of you should know. So this is about cornea. Okay, now coming over to the sclera. Let's come down to sclera. Now if I dissect the structure of eye for you guys, so which structure lies most superficial on the eyeball? Can you tell me? Don't get confused. So first and foremost is your conjunctiva. What lies underneath conjunctiva? Don't say sclera. It is your Tenon's capsule. Tenon's capsule, it is a fibrous sheath. What lies under Tenon's capsule? It is your sclera. But sclera has got 3 layers, which all of you should remember. Superficial most layer, because conjunctiva is most superficial. We are going from superficial to deep. So the superficial most layer of the sclera is episclera. Don't think that episclera is something which lies over the sclera. No, it is a part of sclera only. Then second layer is sclera proper. Third layer is lamina fusca. And you know, next is choroid, and last is innermost part is retina. Okay, in between choroid and retina there is one special membrane. Can you tell me the name of the membrane? As we will proceed forward, we will be doing about this. This is your Bruch membrane. It has got its own relevance, which will be doing whenever, wherever it is required. So this is the normal anatomy. Okay, so there is conjunctiva, then there is Tenon's capsule, then there is sclera. Sclera has got 3 parts. Then there is choroid, and innermost layer is your retina. Okay, all right. So this is about your sclera. Now coming over to this image. Now, so there is optic cup which was being formed. Now the optic cup has got 2 layers, the inner layer and the outer layer. If you could recall, this is the yesterday's diagram. So this is your inner layer. This is known as neurosensory layer. Wait, I'll just use the thin, yeah. See, this is known as neurosensory layer, while this is known as retinal pigmented epithelium. Okay, now neurosensory layer is actually inner 9 layers of the retina. हमने कल करा था ना, we had did it yesterday. Inner 9 layers of the retina, while retinal pigment epithelium is outer 10th layer of the retina. So we are starting from inside to outside. Okay, now I am writing in detail what is NSL. It is neurosensory layer. What is RPE? It is R for, of course, we are talking of retina. Retina, because it has got melanin pigment, so we call it as pigment. And it is epithelium, so you call it as retinal pigment epithelium, which is the outermost 10th layer. Now the optic cup, inner layer neurosensory layer, outer layer pigment epithelium. So they are proceeding forward, and at the periphery they are going to form which structure? They are going to form ciliary body. Now I am going to explain it here where I have space. So this is your cup. As I had told you that you need to make your own notes. So don't think that, you know, on one page I am writing everything. You are going to make your own beautiful notes. So this was your optic cup. Okay. Now the retina is formed from inner 9 layers, neurosensory layer, and outer 10th layer, which is retinal pigment epithelium. But these 2 layers are going to proceed forward. And now there will be one structure which will be your ciliary body, and further when the cup will close, so 2 layers will become common, again coming here, again coming here. Now they are forming one structure which is your iris. समझ में आया? Okay. Now ciliary body has got 5 layers while iris has got 4 layers. Now out of the 5 layers, these 2 layers are same in ciliary body as well as in iris. So that means in ciliary body, how many layers do we actually need to remember? 3 layers. And in iris, how many layers do we actually need to remember? Just 2 layers. It becomes very easy, conceptual. I told you that we are going to read everything very conceptually. Now, the inner layer of the retina, which is in continuation, is going to form the inner layer of ciliary body. So let's write ciliary body from inside to outside, because I told you the 2 layers will be in continuity. So one is non-pigmented epithelium, non-pigmented epithelium. Then second layer is, of course, retinal pigment epithelium continuation. So it is your pigmented epithelium. Done? Okay, 2 layers are done. Now you will think, sir, what structures are surrounding this optic cup? So there is some tissue, liquid tissue, which is surrounding. You call it as mesenchyme. Okay, this mesenchyme is going to form the stroma of ciliary body, and the outermost wall of the ciliary body, you call it as supraciliary lamina. Supraciliary lamina. So I told you how many layers of the ciliary body are there? 5. But how much layers, how many layers have we written? 4. Sir, where is the 5th layer? Now I am going to upgrade it a little bit. So I told you, if we talk about the retina, so retina inner 9 layers. I told you inner 9 layers, neurosensory layer. Now neurosensory layer means first layer, second, third, fourth, fifth, sixth, as such 9 layers. But so this is the inner part, this is the outer part. Now the innermost layer of neurosensory layer is your first layer from inside, है ना, innermost layer, and the name of this first layer is inner limiting layer or inner limiting membrane or internal limiting membrane. It's one and the same thing, internal limiting membrane. So actually, if we talk about the optic cup, so one is internal limiting membrane, then 8 layers. Of course, neurosensory layer is 8 layer plus internal limiting membrane. So for ciliary body layers, I am asking you to separate internal limiting membrane with that of 8 layers. Yes, and the outermost layer is retinal pigmented epithelium. Now, how many layers of ciliary body should be there? 5, but here I have written 4. Add one more layer, which is your innermost, and that is your internal limiting membrane. That is nothing but you have separated the neurosensory layer with that of inner layer, which is internal limiting membrane, and 8 layers. So this non-pigmented epithelium is the continuation of not 9, 8 layers. Inner is 1 layer, which is inner limiting membrane, and pigment epithelium is the 10th layer. Is it understandable, my dearest boys and girls? 10th layer. And outer 2 layers you are already aware of. Okay. All right. So these are your 5 layers of ciliary body. Now it is proceeding further. Now please remember, inner limiting membrane will only lie till ciliary body. At iris level, it will vanish. It will be finished. Now, how many layers of the iris are there? 4. Now you already know the 2 layers. The 2 layers are again, so from inside to outside. from in to out, innermost layer was pigmented or non-pigmented? Innermost layer was non-pigmented. Now let's write for once non-pigmented, because this is innermost, now this is outer. Non-pigmented, okay. Outermost was pigmented, so this was a retinal pigment epithelium now, so it will become out, because so cub is getting closed, so it will be pigmented, okay. But what happens during a transition from ciliary body to iris? The non-pigmented layer gains pigment, while pigmented layer loses the pigment, such that the innermost layer become pigmented and outermost layer become non-pigmented. And again, if we go from inside to outside, so this is of iris is now pigmented and this is non-pigmented, and of course it is surrounded by which tissue? The liquid tissue, which is mesenchyme, which is going to form stroma, and the anterior most layer of the iris is, of course, anterior limiting layer, which is limiting the iris anteriorly, so that is your anterior limiting layer. I hope it is well understood. So I am taking everything very slow, very conceptually. Yes, so that is the idea, because I want you people to understand each and every part. So we have done 5 layers of the ciliary body. Let's revise. So inner is internal limiting membrane, which is continuation of the inner layer of the retina. Then we have got neurosensory layer, which is the collection of 8 layers. Then we have got pigment epithelium. So we have got 3 layers of the ciliary body. 4th is derived from mesenchyme, which is stroma, and 5th is supraciliary lamina, that is also derived from the mesenchyme. Okay, now talking of the iris. So iris, the non-pigmented epithelium gains pigment, while pigmented epithelium loses pigment, such that the posterior most layer is pigmented, then anterior layer is non-pigmented, and other 2 layers are formed by the mesenchyme only. They are formed by the mesenchyme only. So there will be same stroma as we had in ciliary body, and in ciliary body we had got supraciliary lamina. Supra means super, means above, ciliary means ciliary body, and lamina means layer. Similarly here the outermost layer is anterior limiting layer. Okay, now the ciliary body is attached, ciliary body is attached to the structure which is ciliary spur. It is present where? It is present on the sclera. So there are teeth like structure, spur, which is arising from the sclera, to which ciliary body is attached, and ciliary body is a triangular structure. It is a triangular structure, ciliary body. I hope it is clear. Okay, we are doing anatomy and embryology, yes, step by step. Now if we talk about iris, so we have done the blood supply of uvea. 4 layers we have already done. Coming over to iris, so now the root of the iris, the root or base of iris has the anastomosis of 2 blood vessels, which we had done in blood supply of uvea. One is long posterior ciliary artery, long posterior ciliary artery, and anterior ciliary artery. So long posterior ciliary artery and anterior ciliary artery. So both of these vessels, they are forming anastomosis, and this is known as major circulus arteriosus. Major circulus arteriosus. Is it understandable? Okay, now these vessels which are forming the major circulus arteriosus all at 360 degree at the root of the iris. So if there is blunt trauma, this is the source of blood. Source of blood in the anterior chamber in trauma means अगर आंख पे बॉल लगेगी और आंख के अंदर खून की नाड़ियां फटेंगी, if there will be breach of vessels inside the eye, of course the blood which will get collected at the bottom of anterior chamber will come from major circulus arteriosus. That is what I am trying to say. Then there is another structure which is minor circulus arteriosus. This is actually extension of the blood vessels from the major circulus arteriosus and goes till pupillary margin, inner pupillary margin. It goes till inner pupillary margin, inner pupillary border, just 1 millimeter outside, 1 mm outside the inner border, to be more specific. All right, so this you have understood. Okay, now if we are doing iris, now iris has got two muscles. One is sphincter pupillae, you have read it in anatomy, yes. Another is dilator pupillae. So these are two muscles. So how many layers of the iris are there? Let's revise one more time. So starting from inside to outside, so we have got pigmented epithelium, we have got non-pigmented epithelium, stroma and anterior limiting layer. Yes, I hope it is clear. So these are your layers of the iris. Now the sphincter and dilator pupillae, they are actually present in the stroma of the iris. Now can you tell me what is the derivative of which is forming sphincter and dilator pupillae? You will say, sir, okay, it is in stroma. Stroma is formed by mesenchyme, so it has to be mesenchymal in origin. Yes? No, my dear friends. Of course, sphincter and dilator pupillae, they lie in stroma, but they are secreted by anterior non-pigmented epithelium. Anterior non-pigmented epithelium. Okay, so I had told you yesterday, अगर आम का पेड़ लगाया है तो उसमें अमरूद तो होंगे नहीं. Anterior non-pigmented epithelium is a part of optic cup. Optic cup is neuroectodermal in origin. So sphincter and dilator pupillae, they are also neuroectodermal. Don't say that okay, it is a muscle, it has to be mesodermal. No, it is neuroectodermal in origin, the sphincter and dilator pupillae. So these are few important things that you should definitely know. Now I am talking of mesenchyme here and there, mesenchyme. This mesenchyme has the ability to get transformed into mesoderm, or in the initial stages neural crest. So if we talk about the ciliary body, if we talk about iris, it is actually mesenchyme which is forming neural crest. I hope it is clear. Okay, it is neural crest. All right, now coming to the image. Okay, so you can appreciate there is a structure which is lens and which is held by the suspensory ligaments. You call it as lens zonules. Lens zonules. Okay, now I am going to tell you one important dimension of the eyeball, that is the back of the cornea, which is endothelium, to the anterior surface of lens. What is this known as? This is your anterior segment. Anterior segment. Now anterior segment is divided into two chambers. One is anterior chamber, another is posterior chamber. समझेंगे, यहाँ पे focus करेंगे, please focus. Now anterior chamber is from the back of the cornea till the anterior surface of iris. Okay, but posterior chamber is from the posterior surface of iris and anterior surface of zonules, lens, etc. Okay, so this is your posterior chamber. So I won't be wrong if I would say anterior segment is anterior chamber plus posterior chamber. Now please remember, in the posterior chamber, if we talk about posterior chamber, there are plications of pars plicata. There are 70 plications which help in formation of aqueous humor. It forms aqueous humor. So aqueous humor is formed in the posterior chamber. Through the pupil, it will come into the anterior chamber and it will go to the iridocorneal angle, and then it will slowly go out of the eye. We'll be reading about this in details, don't worry. But for now, it is important to understand the anatomy of eye. So we have done the layers of the eyeball, the coats. We have done about conjunctiva. We have done about embryological derivatives. We have done about anterior segment. Now, the line from posterior surface of the lens to the anterior surface of retina is known as posterior segment. Anterior is cornea till the anterior surface of lens. Posterior segment is from posterior surface of lens and the anterior surface of retina. This contains what? As it is written, this contains vitreous body or vitreous humor. So vitreous body is what? Let's write it here. I am again hoping that you are making good notes, right? So vitreous body is vitreous humor. It is a liquid glass like structure. Liquid glass or jelly like structure, and it lies in the posterior segment. Okay ji, all right. So uvea we have already done, है ना. अब बात करते हैं रेटिना की. तो रेटिना की मैं यहाँ पे I'll make a short diagram of retina. So this is your retina. This is optic nerve head. This is optic nerve head. Okay. So after knowing about the layers of the eye, so now it's time to examine the retina of the patient. Now this part, this optic nerve head has got a standard diameter of 1.5 millimeter. And it lies on the nasal side. So it is not lying exactly at the center of the retina. It is lying centrally nasal, है ना? So whenever you examine the fundus, you always examine as if how you are going to see this. If this is the fundus image and it has to be, the optic nerve has to be on the nasal side. So can you tell me, is it right eye or the left eye? So it is your right eye, because the optic nerve head will lie nasal. If you are seeing from front of the right eye, so optic nerve head should be onto your right, like we on in this image, the optic nerve head is on my right. Okay, now The central most sensitive part of the retina is the posterior pole, which is your fovea centralis. Fovea centralis. Here we have got only cones. Fovea centralis. Now the distance between the fovea centralis and optic nerve head is 2 disc diameter. अब आप बोलोगे sir, what is this new term 2 disc diameter? I just told you that 1.5 mm is the diameter of optic nerve head. You also call it as 1 disc diameter. So 2 disc diameter is 2 into 1.5. That means the distance is 3 millimeter on the retina. Now the blood vessels are entering through the optic nerve. We had done it in the first episode. So when it is entering in the optic nerve, the vessels, so this is your central retinal artery, which is a branch of ophthalmic artery. Yes. So central retinal artery has got 4 branches. One is superotemporal branch, then is inferotemporal branch, superonasal branch, inferonasal branch. Okay, all right. So similarly, there is the branching in the central retinal vein. So central retinal artery and central retinal vein. Now let's take the optic nerve head outside. मैंने optic nerve head को बाहर निकाल लिया. Now optic nerve head is divided into the central cup, like we have got cup and we have got saucer na, and the peripheral, you call this peripheral part as neuroretinal rim. Neuroretinal rim. What is neuroretinal rim? It is the exit of retinal nerve fibers. Retinal nerve fibers. While cup is your transmission of vessels. Transmission of vessels. Okay, so they arise like this. Okay, all right. So that is the relevance of cup and neuroretinal rim. The details about this we are going to read in glaucoma, don't worry, but for now you need to know. And the normal diameter of cup to disc, the entire optic nerve head, is your 1.5 millimeter. Yes, so don't confuse your cup with that of optic nerve head. Cup is central area, so the color is pale pink. The color of optic nerve head is pale pink, in which pale part is contributed by cup, pink part is contributed by neuroretinal rim. So collectively it is pale pink. This is what you see while doing a retina examination. Okay, all right. अब देखिए, so this is your lens, है ना? Lens is attached to the zonules of Zinn. What are these zonules of Zinn? Of course, there are ciliary processes, and there is one structure which is ciliary muscle, which is present in the ciliary body. So ciliary body has got ciliary muscles. So what is the relevance of ciliary muscle? Very, very important. I am going to show you a video here. Check this out. So this is cornea, sclera, which is posterior 5/6. Cornea is anterior 1/6. You already know. You are all intelligent bachas. Now fast forwarding it. Yes. Now check out the ciliary body. So ciliary body is entire 360 degree. See, you just need to check this out. 360 degree. When it will contract, so it will decrease in diameter. Now there are threads or lens zonules which are attached to the ciliary body. So when ciliary body will contract, the zonules which are stretching the lens, they will become relaxed, but lens has a tendency to collapse. So as a result of which the lens will collapse and become very thick. Thick lens leads to increase in the power. So more is the thickness, more is the power, and less is the focal length. Now you can appreciate ciliary muscle is contracting. Please focus here. All right. So you can see that the zonules have become very sloppy, as a result of which the lens thickness is increased. This happens in accommodation. Now again you can appreciate. Okay, so we can write it here now. So there are ciliary muscles. There are ciliary muscles which are sort of radial muscles, and when it contracts, so it contracts and leads to loosening of zonules. Loosening of zonules. As a result, the lens thickness is increased. As a result of which the power will also increase and focal length will decrease. So the patient will become myopic or hypermetropic. The patient will become myopic, because if there is decrease in the focal length, now the image will be projecting in front of retina instead of being on the retina. Okay, so this is the function of your ciliary muscles. Okay, now I also told you that there are plications, 70 to 80 number. So this is pars plicata of ciliary body. So there are plications, and there is release of aqueous humor in the posterior chamber. Can you appreciate? So this is the posterior part of the iris and anterior part of the lens. So this is your posterior chamber. So aqueous humor is released. So I am writing it here. Aqueous humor is produced by, it is produced by non-pigmented epithelium cells of pars तो सबको पता है, plicata of CB means ciliary body. Okay, all right. So this aqueous humor then through the pupil goes in the anterior chamber. Then from the anterior chamber it goes into, I am writing it here, this is your trabecular meshwork. From the trabecular meshwork it goes into canal of Schlemm. So I am writing it here. So from the anterior chamber it passes through the trabecular meshwork, from which it goes till Schlemm's canal. Schlemm's canal, from where it goes to, I am writing it here only, episcleral venous plexus. VP means venous plexus. From the episcleral venous plexus it goes till superior ophthalmic vein, inferior ophthalmic vein, then it goes in cavernous sinus. Okay, because ultimately superior and inferior ophthalmic veins, they are going to fall into the cavernous sinus. So it all started with your anterior chamber to trabecular meshwork. So from the anterior chamber to trabecular meshwork to Schlemm's canal to episcleral venous plexus. So this is the pathway of flow of aqueous humor, which we are going to do later. Don't worry, we are going to do it later. But I again repeat, I want all of you to make proper notes. Okay, now ting ding, the bell has rung. So we will stop here, because I want these lectures to be similar lectures to those which you attend in your medical college, so that you don't get tired and you can easily, if you are finding it, you know, not as per your speed, you can always adjust the speed, you can decrease the speed, you can even increase the speed. So today we have done till the, you know, layers, the embryology, the aqueous humor formation, its dynamics, and aqueous humor is formed at the rate of 2.3 microliter per minute. This is the rate of formation of aqueous humor. Rate of formation of aqueous humor. Now, if we talk about aqueous humor, so it is produced by the process of secretion, which is 70%. Then there is diffusion, which is 20%. Then there is ultrafiltration. The contribution of ultrafiltration is 10%. Now, if I may ask you, which is the most important way of formation of aqueous humor? Secretion, diffusion, ultrafiltration. You are going to mark secretion because it forms 70% of the total formation of aqueous humor, and it is secreted by pars plicata cells of non-pigmented epithelium of ciliary body. So yes, so it is all from my side. I am just writing it here. Don't think कि सर ये तो हमें पता ही नहीं लगेगा क्या चीज क्या लिखी है. Of course ये आपके लिए नहीं है. अगर एनोटेटेड नोट्स भी चाहिए हो तो ले लेना, बट इसमें से कुछ समझ भी नहीं आएगा. यू हैव टू मेक योर ओन नोट्स. दीज आर योर ट्यूशन क्लासेस. दिस इज नॉट पीजी एंट्रेंस क्लास के जल्दी जल्दी में 2-3 टॉपिक्स को आपने अपने हिसाब से टच किया, जोन से इंपॉर्टेंट पॉइंट्स है उन पे रीइंफोर्स किया एंड वो हो गया. यहाँ पे हम हर चीज करेंगे स्लोली एंड स्टेडली. वी विल मेंटेन अ प्रॉपर डिसिप्लिन ऑफ द क्लासेस. एटलीस्ट 3 classes a week is my agenda, right? And this is the second class. I had started this series yesterday, so today is the second day. So I have recorded this. Now this video will be available soon. And yes, thank you very much. If you have got any doubts, you can get back to me with my phone number, on my social media like Instagram, Telegram. All the details you already have. That is also provided at the end of episode 1 of Ophthalmology Tuition Classes with Dr. Manish Chhabra. Best wishes from my side. I'll see you in next video.